And Dr. Anagli, if you are online, good morning to you, sir.
Yeah, good morning. Good morning, Joy.
Hi. With us. If you can kindly unmute so I can hear you, sir.
Okay.
So,
Yeah, hello,
thank you
can you
so
hear
much
me?
for joining us on the Mass Morning Show this morning.
You're welcome. You're welcome. Very good morning to our listeners and then the viewers.
So, Doctor, if you can kindly define for us what constitutes masturbation.
Okay. So, good morning once again to our viewers and then our listeners. So, masturbation, this is a big topic, especially among the youth. So, masturbation, in its simple terms, is an act where an individual self-stimulates his or herself, right? You are stimulating your genitals in order to gain pleasure, right? You want to
Doctor,
gain pleasure or sexual pleasure from.
Doctor Pacho Titri.
Between you.
Can be. Wadama, Fachi Frank Akraman one Pacho.
Yeah, ready. Honestly, my cheese that bad. I.
In the
Yes.
studio,
Thank you.
Reverend will take care of the rest. So you continue in English.
Thank you. I'm glad. So basically, an act where an individual stimulates his or her genitals in order to gain sexual pleasure, right? And or orgasm, right? That is basically what masturbation is. Some people call it soapy. I mean, I'm a youth, so I mean, some people call it soapy. Some people call it DJing. The ladies call it DJing. And then yes, basically some people call it beating the meat. Yes, so basically that is what that is what people use their hands, people use soap and water and all that. People use toys, sex toys and all that. So that is basically what masturbation is about. Gaining pleasure yourself.
Are there any recorded side effects, and complications as a result of masturbation?
Well. So this is where the issue is. Masturbation in itself, I'm talking based on, I mean, in the medical side, right? Masturbation in itself is considered probably a normal sexual part of sexual life, right? But the problem comes where it is done in excess and you become addicted. That is where the problem is, right? So yes, there are side effects. Yes, there are side effects. The first one that I'll mention is, can I go ahead and mention some of them?
Yes, of course. Please go ahead.
Oh, perfect. So the first one I'm mentioning is the fact that there's a physical discomfort, or there is irritability, or there is soreness. So you are pulling your genitals up and down over and over again. After some time, you tend to the place becomes sore. I mean, your genitals become sore. You are stressing it out every now and then. That is the first thing. The second thing that I'm mentioning is the fact that it reduces. This one is more or less a psychological thing. So it reduces your edge to the opposite sex. That is basically what it does. Because of the fact that you think that you can please yourself, you can give yourself pleasure, you are not so after some time, you're not so drawn to the opposite sex again. You see, that is what happens. You see, that is basically what happens. The next thing is the addictive tendencies, where an individual becomes addicted. That is where the danger is. Where people before meetings, they have to do it before meetings. People even go to church and then they have to go to the washroom and go and do it quickly because it becomes so addicted. People go to meetings. I'm talking about big people. It's no respect of persons, right? Addiction is no respect of persons. I've had people even from I mean overseas DM me finding ways to I mean deal with masturbation and all that. It's actually worries. It takes a lot of energy. It takes a lot of your time, right? It takes a lot from you if you become addicted to masturbation. People just want to be at home and just masturbate. People masturbate more than once a day and all that. So the addictive tendencies is one of the main things that worries a lot of people. Yes.
We've heard that these days many men suffer from prostate-related issues and so many heart disease and all of that. And somehow it's been indirectly linked to masturbation. Is this a fact?
No, this one, no. So the thing is, the tangent we are going, it may favor my people. I know my people, especially the youth. So you see, let me talk about prostate in general. There are researches that show that the more you ejaculate, the high or the I mean the less your chances of getting prostate cancer, right? So in essence, you are trying to say that the more you ejaculate, so it means the more you masturbate, the more. So I don't want us to go to that with that, and otherwise people will say that I'm reducing my risk of prostate cancer. But then the people talk about infertility and all that. There is no scientific backing to the fact that masturbation causes infertility, prostate cancer, and the likes. No, there's no scientific backing to that, actually.
In your practice, what is the wildest stuff or news you've heard concerning masturbation? And is it a fact?
Well, I wish I could share some of my Twitter DMs or some of my DMs here. It's serious, right? People, people just want to just. The shocking thing is there was one guy from he's actually in US who told me that he's considering resigning so that he just stays home because of the energy or because of the time that masturbation takes. He needs to be free so that he can do it anytime he feels the edge. The edge comes, he can be free. Right. That is one of the shocking things that I could hear somebody say, that because of the fact that he wants to masturbate, they want to cut off so because of that, they are not sociable again. They cut off all friends, they cut off everything because of masturbation. They want to have free time, be in their zone, and do their thing. That is one of the dangerous things that masturbation does to people. Yeah, so that's one of the things that I can share. There are more actually. That I wish I shared some on my Twitter. I wish I could have time, and then we have a whole session with regards to masturbation. Yes.
Okay, so medically, what do you think exposes people, apart from peer pressure and a few other things? Can you share with us what actually put people in a space where they end up masturbating?
Perfect, perfect. So things like this, there's something we call the triggers. So there are triggers, right, to masturbation. For some pornographic materials, right? So they go on social media, they watch a video, they see a picture and they are triggered. So they get into the act. That is basically, so pornography is one of the main things. One of the principal things that is pushing people into masturbation. That is one of the main things. And then peer pressure. People talk about soapy and all those things, and they talk about it like they make it so normal, right? So apart from the pornographic materials, peer influence is also part of things that are causing or pushing our youth into masturbation.
Right. Doctor, we understand that drugs and the likes also push people towards that. In your practice, have you documented anything like that? Is it true?
Drugs generally exposes you to a lot of things, right? Drugs generally expose you to a lot. So if you are somebody who uses hard drugs, who is always high, there is something about there's a link between using hard drugs and then being sexually so active and all those things. So if you are somebody who uses drugs and all those things, and you feel the urge to probably sleep with someone or have an affair, and there is nobody around, you tend to masturbate. So there is that indirect link between the use of these medications, these hard drugs, and then masturbation. Yes, actually. But I have not met a case yet that directly links the use of hard drugs and masturbation, actually.
Okay. Doctor, you mentioned
Yes.
that according to science, masturbation,
Yes.
if it's sparingly, does not cause much problem, except it becomes addictive, etc.,
Yes.
etc. And we don't mean to encourage anybody to go in there. However,
Not at
let's look
all. Not
at
at all.
the reproductive health of this person. You also
Yes.
mentioned that it doesn't affect the person's prostate and all of that. But then let's look at reproductive health and how masturbation can affect it.
Yes. So that is what I mentioned the fact that yes, in as much as it is considered medically, it is considered to be probably a normal part of sexual life, there are consequences. The consequences being that your sexual edge. So the first of all, let me talk about the discomfort. You are pulling your organ back, to and fro all the time. You are pulling your organ every single time you get a chance. You are pulling your organ. You are stressing it, and then it becomes sore. Right. That is the main thing. That is one of the things. The second thing is the fact that where your sexual sensitivity, to sexually related stuff, or having sex with the opposite sex becomes so low or becomes extremely reduced, right? That largely affects reproduction. That is because you are not turned on when you see the opposite sex. All you want to do is please yourself. So yes, in as much as it's considered as a normal part of sexual life medically, right? It as well has that tendencies of reducing reproduction, because your sexual edge towards the opposite sex is reduced. That is one of the main things.
Masturbation, many people use sex toys. What the conversation that brought this to the fore, especially for women, it's like our conversation is on men, but women also masturbate in one form or the other.
Yes, they do
Infections and
a lot.
all of that. Talk to us about it.
Yes. So the use of sex toys. First of all, you are stressing your organ. That is one of the main things. You are stressing your organs, right? And secondly, you can introduce yourself to a whole lot of infections, because these are toys, and after using them, depending on how hygienic you are, you leave it, and then the next time you intend to use it again, you can introduce a whole lot of infections to yourself or to your genital organ, right? So sex toys, one, apart from the fact that it stresses your organ, the next thing is the fact that it can introduce a whole lot of infections to you. And so for someone like me, I don't encourage the use of sex toys. Yes, because of some of these reasons.
All right, so for someone who is
Yeah,
already in there,
yeah,
they
yeah,
do it unashamedly, and then
yeah.
as we speak, the word masturbation is even a trigger for them. Are there any safe, ways to engage? Is there a counsel you can give them medically to help them in that
Yes,
situation?
yes. So first of all, the first step I'll talk about is the fact that you accept the fact that where the thing is getting to is taking a lot of your energy, it's taking a toll on you, and so you want to stop. That is the first step. That is the very first step. Without that, all the other steps, they don't work. They wouldn't work. So the first one is accepting the fact that you're addicted, and then you want to stop. Secondly is avoiding your triggers. Avoid your triggers, right? If your trigger, everybody knows their trigger. Those who are addicted or those who are into the act, they know their trigger. Some people, it's just a picture on social media, or some people, pornographic materials, right? Porn sites and all those things. So that if you are really serious about stopping, or you're really serious about quitting this thing, you delete all those triggers. So if it's porn sites, delete all the porn sites, right? It's not easy. First of all, you have to bear in mind that it's not easy that you stop something that you become so used to, right? So, but the first thing is you accept, and then you delete all those triggers. You avoid, if it's a friend that you see and then the thought comes, you try to cut such friends away. The next thing I'll talk about is get yourself busy, right? Most often when you are idle, you are just there, nothing, doing nothing. That is where these thoughts come. Because our brain wants to be busy, our body wants to be busy. So get yourself busy. If it's games, you can play games. If it's going out, you can go out and all that. Get friends that will help you. The next thing is get groups, right? There is this time that I conducted a survey on Twitter where I asked people how they overcame their masturbation and all those things. And somebody told me there is an account on Telegram, on YouTube and all that helps them. There's this Kenyan doctor Amerix. He has a Telegram channel that's people who are addicted. They go, and then he takes them through this process one after the other, and then they're okay, right? So that is another thing. Get groups, get people that are also in the act, and you are motivated to stop, right? And then you follow it. The next thing probably I would like to talk about will be the spiritual aspect. When I asked people say yes, yes, yes. When I asked, people told me. I mean, I had a few people that told me that they prayed. I am a medical person, right? But when I conducted a survey, it worked for people, right? It worked for people. They prayed. They say when the edge comes, I read my Bible. When the edge comes, I read my Quran, and it worked for them. So find in that aspect, find what works for you, so that you can break free of some of these addictions.
All right, Dr. George, before we let you go, one last question.
Yeah.
Yesterday, one of our callers mentioned that she's dating someone who has been addicted to masturbation for so many years. In fact, his first wife left him as a result of that. And now he's extremely sexually weak and is unable to hold an erection for even 30 seconds. And she thinks it's because the man masturbates a lot. Would you concur?
Yes, I agree. I concur. I totally. You see, that's what I said. That you become so addicted to the act that the only thing that pleases you is the masturbation. So you see your female partner. I talked about the second side effect being the reduction in your sexual edge towards the opposite sex. So because you can please yourself, your brain has already registered it that the opposite partner is not needed. So you can please yourself. So you can see the opposite partner all, I mean, naked and all that, but you don't feel anything. You don't have the edge to do anything. That is what happens. So I totally agree to that. It's actually the masturbation, and I would advise they see a professional when you try all this avoiding trigger and all those things, and you are still not getting headway. Go and see a professional. There are people that will take you through a course, and then you'll be free. Yes.
Dr. George Anagli, we appreciate your time immensely on the Mass Morning Show this morning. It's been awesome talking to you.
You're welcome. You're welcome. Nice
Great.
talking to you guys too.
All right, so we were talking with Dr. George Anagli, doctor of pharmacy, here on the Max Morning Show. We're looking at the medical perspective of masturbation. Wakasa pi, or say masturbation, no, me mani define medically. Okase se sebi obi ede ni bema anase ni ba edi agro anase odi bibi fufuro bi beka ho na okase medically no say we nya de anipa bebre be pese wo bete, but sometimes science contradicts culture and religion. Science say nka we yan once in a while nka emfa nsonsanso boni bia mma nanso no se beka wo ho na de bia wo ya also we ye bema seni a woka no ebetumi amasebi wo bema ni mu ahoden ne so ate afe wo hia wo ba kora oye wo yire a wate sika ne ho ade kora oda wo nchen ona ne shape ti so ba bia menim no wo fia ha ahweni agu na so ode hwehwade agu ne ho aboni ti kama oda mpam na osere kire wa ne wayi wani ahwe ban efi se wow to me eye ho yie ema wani je so wahuno oka mibusa ne say yes prostate ene akoma yare ani noma bi anipa emema bebre nam so wu no masturbation so kan wo ka say ne kura bi anim eba no abode mu nyansa pa mu a science bibia ni ho a kire sa yedi nkomo ni koyanim na